had as a local community, as patients and the public, you had not been involved in looking at the impact of those cuts, how they would have affected you as individuals, as families, as communities, and how any adverse effects could have been mitigated. None of that work had been done by the commissioners for us or for any of the other surgeries nationally. So ultimately, if it would have come down to a fight and the legal challenge, which is where it was heading through the it was possibly heading to judicial review at one stage, you know, I think the group would have won. So that you know, we were fighting from a position of strength, and we were able to achieve a compromise. Just remember, we still had funding cuts to implement. We're in the process of that now, but not at the scale that was envisaged. So that concept, you know, there's legal, as individuals, as citizens, as patients, we have serial, you know, the law is on our side. If people want to change the services that we receive at a local level, the law is there, you know, in many different ways. Commissioners and other organisations have to involve us in the changes that they're making. I think that will come up later in the discussions about what's more happening more widely. Okay, moving on to the second heading. How does it just got a finger on the pulse of general practice? I think GPs for a couple of years have been kind of feeling that we collectively, as a profession and as surgeries, are voyaging towards a kind of tipping point, that we are struggling to keep the show on the road. And that's due to a number of factors, but fundamentally just overwhelming workload, overwhelming demand. It's upon us for a complex set of reasons, but fundamentally there aren't enough GPs, there aren't enough nurses and support staff to do what is a rising tide of work. As the wider health and social care system is affected by cuts, it restricts access, it restricts services, and everything comes back to your GP. GPs are the only bits of the system that can't say no. We don't turn people away. And I'm sure, you know, we have very high levels of access at the health centre, always in the you know, top 5%, I think it is, nationally for access, but even the best we're doing now, some of you will be aware that at times you're not getting that same level of access, I suspect, because we're overwhelmed. So I think it's going to be, if we talk to other surgeries around Huddersfield and more nationally, you know, a picture would be emerging of really a sort of crisis situation. And I think that, you know, over these next few months, over the next year or so, we're just going to see more and more surgeries who are not able to continue in their current form. So that leads me on to the sort of final point, and just my last couple of sentences, which were around, so what? You know, if the system as it stands is distressed and perhaps viewed to be failing, then what comes next? And I think the politicians would say, well, that's with NHS England, that's the strategy for the NHS and social care is the 5-year forward view, or is that the right term?
Yeah.
The 5-year forward, Jenny would help me with that. So this is a kind of overarching policy document, not written by a political party or government, but written by NHS England, which is the sort of quasi-independent representative of the NHS, the commissioning organisation, that envisages really a completely different world of health and social care provision, loosely under the term of an accountable care system or organisation. And that phrase, or ACO, will keep coming up this afternoon. And I'm hoping in the conversation somebody can explain to me what it actually means. I work on the inside, I don't really understand it either. But loosely, it envisages a completely different delivery model where there is a single organisation that is accountable for managing a fixed budget that's dependent on the size of the population that's covered, but responsible for the delivery of the whole of health and social care. And there's multiple, thousands of different models through which that could be enacted and delivered. But probably what it doesn't involve is a free-standing small GP surgery in every district. I'm not saying that means that, you know, there's no immediate threat to Slawit Health Centre as it stands at the moment, but the current contractual model, where that's a small surgery with a relatively small value contract with with a small number of GP partners, is probably not what the government and its agencies see in the future. So I think that's the other challenge for GPs, is that we would say that we're distressed, we're struggling to keep the show on the road. But we're also struggling to see how we transition into the new world. How do we, on the one hand, we're fighting to keep the place open, keep the services going, but on the other hand, can't really, it's not clear to us yet where we're headed. So my 10 minutes is up, and I have lots of questions.